And friends, why I'm saying this? Because we are 8 siblings. Out of 8, 7 are diabetics, except me. But in my house, my daughter is type 1 diabetes, Pamela Fernandez. We have done the genetic test, and Riddhi has been, our counselor has been helping her to cope up with her complications. And last 6 years, she's really doing well with her lifestyle modifications, etc. And today, you must take full advantage of this seminar, this webinar, this very special session. Attend it very actively. Keep some notebook, and write your notes as well. Write questions, whatever questions you want to ask. Because we have today a very, very special speaker who is very compassionate, very understanding, and listens to the people, their problems. And diabetics has lots of complications, as we all know about it. And today I'm going to invite, and of course there are few rules today, that please keep your cameras on so that we can see you, and audio off. So don't make noise, do not disturb the speaker, because it is a very, very special session today. And if your camera is on, don't move here and there. And this person, who is RIDDHI SHAH, is an experienced nutritionist and a certified holistic health coach, working with the passion to help people live a healthy life. With over 16 years of work experience in effective lifestyle management, she has successfully helped numerous individuals live a holistic life, which revolves around not just physical, but also mental, emotional, and spiritual well-being. She is also a postgraduate in yoga, diploma holder in yogic nutrition, certified diabetes educator, certified in translational nutrigenetics, and is certified in positive psychology. Holistic living is a need of the hour, is her genuine conviction. Instead of quick fixes and crash diets, which are temporary, we all must adopt natural, effective, and result-oriented lifestyle modifications, is what she credibly advocates. She has successfully reversed multiple lifestyle disorders of her clients, such as diabetes, heart conditions, hormonal issues, gut issues, thyroid issues, early stage cancer, and liver diseases. At Velocity Genetics, as we are pioneers in the industry about genetics and so wellness solutions, Riddhi holds effective counseling sessions for our valued clients, creates targeted action plans, and provides follow-up. And she has counseled over 1,500 esteemed clients. Amongst them, at least 25 are my family members. She is also a faculty of CCNG by Vignet. And one small testimony I have about myself, I am 67-year-old. When I did my genetic test, they said I may have high diabetes, high cholesterol, high pressure. But Riddhi, I've not mentioned here, I have seen our session. She even teaches on microgreens. And I have been using microgreens. They are really very effective. If we have that session on the YouTube, please watch. Every Thursday, we have these webinars, very special for a healthy living, and we all can make use of it. And today, please enjoy this session, and let us all welcome Ms. RIDDHI SHAH with our claps, webinar claps. Welcome, Riddhi. Welcome on board.
Thank you, ma'am. Thank you so much for that lovely introduction. And I'm indeed blessed to have you in our, family, I would say. Not company, but I would like to say family, right? So yes, I hope everybody is able to hear me clearly. Just put it in the chat. Yes, I just wanted to ask everybody so that there's no disturbance, anything? Yeah. So once we start, then we'll go into the topic of the day. Yes, thank you, Jitu sir. And I'm so glad to see all of you, my ex-CCNG alumni. Jitu sir, hi. Rovina ma'am, hi. I can see you smiling there. Lovely. I'm so happy to see you all. And of course, my latest batch of CCNG that we did some months back. So I can see Maino ma'am, I can see Nilima ji, hi. I can see Rakhi ji. Lovely. Alpa is also here. Great. So good to see you all. And yes, Kushal, how can I miss you? I saw you. Yes. Hi. Okay, so let's start today's session. And today we're going to talk about something that this month is celebrated for. And you might be thinking like, what is there to celebrate? But yes, that is the awareness that we are celebrating the whole of November. So November is Diabetes Awareness Month. 14th of November, that is gone just last week. That was World Diabetes Day. But to create an awareness about this slowly creeping, very prevalent in modern lifestyles and, urban cities, this kind of a disease, to create awareness about this disease, we have, the whole month that we are creating this awareness. So yes, let's talk about November special diabetes as a central point of conversation today. So just let me share my screen and I'll go into it directly. Okay, so I believe that you're able to see my screen. Florine ma'am, can you just confirm?
Yes.
Yeah, thank you, ma'am. I could hear that. Yeah, okay, yeah. All right, so what is diabetes? Yeah, so we all know what is diabetes, but why am I doing this is so that we have a base to start on. Okay, so we're not just directly entering into the genetics because that can get a little technical. So let me talk about how this problem is as I said, it's a very raging issue today because India is again the diabetic capital of the world, right? So we were on the second position, but now we are on the first position because of a lot people turning into diabetics, thanks to our poor lifestyle and our genetics as well, right? Come on, let's understand this problem. And diabetes is basically a metabolic disease. So what is metabolic? Metabolic means anything that is handled in the body. So any process that is handled in the body. So how food is handled in your body and what that results into is termed as metabolic, right? So here in this case, what is the food that we are talking about in case of diabetes? It's your glucose, right? The glucose that comes from your diet. So it's a metabolic disease that causes high blood sugar. It occurs when the body either doesn't make enough insulin, so there is not enough insulin, or there is no insulin at all, okay, or it cannot effectively use the insulin that it makes. So there are two scenarios here. One is किसी के body में insulin बन ही नहीं रहा है, so there's somebody who is not able to make insulin or makes very little amount. और secondly, there is another scenario जहां पर आपकी बॉडी में इंसुलिन तो बन रहा है पर वो यूज नहीं हो पा रहा है, राइट? सो द पर्सन कैन नॉट यूज दैट इंसुलिन वट एवर लिटिल अमाउंट इज मेड, करेक्ट? सेकेंड इज diabetes is of major concern in India because it affects, it's the most commonest health problem, right? And you see every third, fourth person is a diabetic nowadays. So it not just affects your pancreas or your blood sugar, but it also affects all the other systems of the body. And that's exactly what we are going to look at. All right. So how do you know, or maybe how do you understand diabetes? Is one of the most common symptoms of diabetes is hyperglycemia, that is high blood sugar. So now I want you to understand here is, so one day if I eat something now after Diwali, when I check let's say I check my blood sugar levels and it comes as high, that does not mean that I'm a diabetic. Okay, that does not mean that I'm a diabetic. It's just probably a temporary rise in the blood sugar levels. Okay, but if this is consistently high, so can you see this word? I'm focusing on this word, consistent high blood sugar levels or blood glucose levels, that leads to a disease called diabetes mellitus. The clinical name of diabetes is diabetes mellitus. All right. And basically, it's an endocrine disorder. So endocrine has something to do with hormones, right? So endocrine is hormonal. So why is it hormonal? Because we know that there is a hormone in the body that is secreted, which helps you to keep your blood sugar levels in check in the normal range. And that is called insulin. Correct. So here it's in diabetes, it's basically an endocrinal disturbance in which there is insufficient amount of insulin secretion to metabolize the carbohydrates that you eat through your diet. Clear? Now, why is it so important to prevent diabetes? So a lot of you might be here, in this room might be a diabetic themselves. I mean, you yourself are a diabetic, or know somebody in the family, in the friend circle, in the neighborhood, in the society, in your groups, in your community, or we know so many people who are suffering from this condition, right? And so it's been told that it's a lifestyle disorder, correct? But definitely it's a lifestyle disorder. I agree to that. But today we are going to see a genetic angle to it. Today we are going to see how genetics can also lead to diabetes. All right. So yes, insulin as a hormone, उनका main काम क्या है insulin का? It moves sugar from the blood into your cells where it is stored or used for energy. If there is a problem with this process, you can get diabetes, correct? And of course, it can not just damage your pancreas, as I said, it can also damage your nerves, your kidneys, your eyes, your other organs as well. And hence, we are focusing a lot on educating the masses on this condition, because if they do not take care of their lifestyle, they will definitely end up with diabetes. And you see the prevalence of diabetes, it's been estimated by 2045, there are many cases that are estimated in the country, right? So we need to educate the masses. So if you see, there are usually 3 types of diabetes. One is type 1 diabetes, type 2, and which is the third one? Something that happens in pregnancy. Okay, so that is called gestational diabetes. So now here type 1 में बिल्कुल insulin नहीं produce होता है. So there is no insulin at all that the body makes, and the patient who is suffering from type 1 will have to take external insulin, all right, through injections and stuff. Secondly, it is type 2 diabetes, wherein the body is producing insulin, but it is not enough to get utilized, or maybe it is not able to perform its function of clearing the blood glucose, correct? And the third one is gestational diabetes. As I said, it happens in pregnancy. So are you all clear till now? Just put a yes or no in the chat box. Are you all clear till the basics of it? Yeah, then we move ahead. Then we move ahead to how you can decipher, or how you can understand whether, somebody is suffering from this condition, and then can send to a proper, endocrinologist or a diabetologist. All right. Yes. So let's talk about, thank you so much everyone who's putting in the chat. Yes. So let's see the symptoms. How do you diagnose it? Okay. First of all, we are not anybody to diagnose. It's only the doctor's responsibility to diagnose it. But if there is anything that is more than 2 symptoms that you see here, anything more than 2 symptoms out right from the list here, you need to send that person to the diabetologist. Okay. So when there is frequent urination, the person is visiting the loo too often. When there is blurred vision, when there is an increased thirst, ओके बहुत ज्यादा प्यास लगती है, बहुत ज्यादा यूरिनेट या पेशाब लगती है, ब्लर्ड विजन यानी धुंधला दिखता है, फ्रीक्वेंट इन्फेक्शंस कमिंग अप, या सो बार बार इन्फेक्शंस होना पेट का, स्किन का, आंखों का, कान का, या इंक्रीज्ड हंगर, ज्यादा भूख लगना, पॉलीफेजिया इज व्हाट इट इज कॉल्ड, slow healing sores. That means whatever sores or ulcers or any kind of a wound that you have, it's very slow in healing. It's not able to heal itself. That means you just need to be a little more wary of it. Okay. Fatigue. The person gets tired very easily. Okay. Areas of darkened skin. So sometimes, people have this neck line, which is like pigmented. Okay. And usually it's in the armpits or and the neck area, right? So if you see a lot of darkened skin over there, you need to know that that condition is because of insulin resistance. That condition is called as acanthosis nigricans. Okay, so that is something that comes under dermatology, but yes, it is a sign of insulin resistance. The other symptoms are unintended weight loss. You're not on any weight loss program, but dar weight kam ho raha hai aapka, right? So you need to be careful about your weight as well. Tingling, numbness or pain in hands or feet. So if you feel कि पैर और हाथ सुन हो गए हैं, वो हम कहते हैं ना मूंगी आ रही है, ऐसा sensation होता है, right? So that's one symptom of diabetes. The reason why I'm showing you this slide is because, see, most of us know कि हाँ भाई, प्यास ज्यादा लगती है, भूख ज्यादा लगती है, पॉलीडिप्सिया, पॉलीफेजिया, but ये जो छोटी छोटी चीजें हैं, जैसे टिंगलिंग है, फ्रीक्वेंट इन्फेक्शंस है, विजन में प्रॉब्लम आना, एनर्जी लॉस होना, ये थोड़ा सा रेयर होता है. बट यस, इफ somebody is getting any 2 or more symptoms out of this, they need to consult a doctor for that, and they need to get it checked. So always go for a blood sugar check and then go to a diabetologist. All right. And of course, let's see the causes. So what causes diabetes? One is the first factor is genetics or heredity, right? You're more likely to get type 2 diabetes if a close family member has it. So this is where we are going to talk more about today. And second is physical inactivity. If you live a sedentary lifestyle, you are at a higher risk of diabetes. If you're obese, you are at a 20 times more risk than a normal individual to get diabetes. Yeah, so if you are in the overweight or the obese BMI category, please come down to the normal one. All right. Smoking. Now, if you are an active smoker, you are a 50% higher risk of getting type 2 diabetes than a non-smoker. But also, if you're not an active smoker, you don't smoke cigarettes, but you have passive smoke. When you inhale the smoke that somebody else is emitting, you also have a 20 to 25% chance of getting diabetes, because passive smoking is equally dangerous. All right. And of course, how can we forget diet? Because that's where your glucose is coming from. So whether you choose maida, whether you choose whole wheat flour, whether you choose a bread or whether you choose an apple, I'm just giving random examples so that you understand. That choice will directly determine your risk of diabetes, because if on a consistent basis you're consuming refined, simple carbohydrates, your body will definitely, it's more prone to diabetes. All right. And of course, as I said, this is a creeping disorder that occurs mostly in urban cities. So people who live in cities are at a 65%. So 65% of the urban population is at a higher risk for diabetes. And that is why you see a lot of urban people are coming up in, getting diagnosed with diabetes, right? So that's what we're going to talk about. And that the most important thing today is genetics. That the conversation for today is how genes have an impact on your blood sugar levels. And not just that, we are also going to see how genes have an impact on the complications of diabetes, which I will cover shortly. All right. So why are we focusing on diabetes prevention and management is because this is a recent study that has happened, and it says that over 100 million people in India have diabetes, right? And which what do you say, state has the highest number? The cute little Goa has a highest number of diabetics. Yeah, so that's very alarming. This is a recent study that was done in 2023. And see, can you see this? The ICMR study, the same study done by ICMR, says that diabetic cases have increased by 44% since 2019. So ये 4 साल में क्या बदल गया है? Maybe sedentary lifestyle has gone up. Maybe, a lot of stress has happened. A lot of urbanization leads to a lot of stress as well. Correct? So we don't live a slow life. We kind of try to cope up with a fast life, right? And that could be a contributing factor, right? And so the question is diabetes curable or reversible? So what does what do the bodies say, the societies, the governing bodies, I would like to say, what do they say? Okay, so we are not going to hear anything out of Google. Okay, we are not going to talk about that, but it is very easy to use words like, you can reverse diabetes, definitely, but the correct clinical term is remission of diabetes mellitus. What is remission? So let me explain that to you. So there was this article that had come, and remission hope for people with type 2 diabetes. Yeah. So there are certain criteria. Now look, listen to this very carefully. And this is exactly what we do here as well. We monitor them so that, they enter the remission phase, wherein it's easier for them to, live a normal life, the one that they were living before they got diagnosed with diabetes. Okay, so there are 4 bodies here. The one is Endocrine Society. The second one is European Association for the Study of Diabetes, Diabetes UK, and the American Diabetes Association says, what do they say? Number 1 criteria, people who have type 2 diabetes, okay, the one in which insulin is insufficient, okay, or insulin is not getting utilized, type 2, the most common form of diabetes. People with type 2 diabetes who sustain normal blood sugar levels for 3 months or longer without medicines. मेडिसिन के साथ तो चलो हो ही रहा है बैलेंस आपका, ठीक है, बट एक बार आपने ऐसा लाइफस्टाइल अपनाया, once you adopt such a lifestyle which helps you leave the dependency on medications, they can be said as entering into remission. They can be considered in remission because now without medications their body is beautifully able to balance those blood sugar levels. Yes, all right. Secondly, the second parameter or criteria is when the value of a blood test parameter called HbA1c. I'm sure all of you know about HbA1c. It's just 3 months average blood sugar levels. Okay, this is a more accurate form of blood sugar. So yes, when your value of HbA1c is below 6.5, so आपका HbA1c का test 6.5 के नीचे आता है लगातार 3 months तक, for at least 3 months continuously after stopping medications, that is when you've entered the remission phase, and that is when you can enjoy a normal life. All right. And lastly, so what we say is, how is it possible? How are these two things possible? As I said, कि एक तो बिना medications के आप normal blood sugar कैसे पा सकते हैं, and HbA1c भी 6.5 कैसे आ सकता है आपका? So that is exactly what I'm talking about here, is through weight management and other lifestyle linked changes. So once you check your weight, you watch your weight and keep it in a normal BMI, as well as you also keep a tab on your lifestyle habits like sleep patterns, exercise, correct diet, stress management. All these things will help you to enter the remission phase if you're a diabetic. Trust me. And that's exactly what we've been doing at Velocity Genetics, by understanding the gene behind the person's diabetes and how do we actually help them to enter remission. All right. Take a screenshot if you want to. I'll go ahead. Okay, so what we've been doing till now, हम अब तक क्या करते आ रहे हैं? So that is the regular treatment of diabetes. But now what we are doing through a genetic test is basically very, very personalized, because genes, I mean, every human being is unique, right? So we have different genetic tendencies. So let's understand that, and that we'll come to that later. But let's understand the basic difference between what the conventional method of diabetes was and now how do we personalize it further, right? So the regular treatment or the conventional treatment was oral hypoglycemic drugs or medications. Yeah, so that is your metformin, pioglitazone, glimepiride, etc., etc. So those are called OHDs, that is oral hypoglycemic drugs. Okay. Insulin therapy. Some people who have uncontrolled diabetes, along with oral hypoglycemic drugs, they're also suggested insulin, right? But some people who are into the type 1 phase, they are not given oral hypoglycemic drugs because there is nothing that is produced जिसको आप दवाई से और produce कर सकते हैं, right? So they are not given drugs, they are giving only insulin. Okay. Self-monitoring of blood glucose, SMBG, is done by the patient or the patient's caretaker, wherein you use a glucometer and understand your blood sugar readings every week or whatever frequency you've decided. So you're monitoring it on your own. Regular health checkups to avoid complications. So this is the conventional treatment, okay? The conventional way of approaching diabetes. And of course, medical nutrition therapy. So we also give a diabetic diet, right? So that's what it is called in hospitals. It's called diabetic diet, okay? So what is a diabetic diet? A low to moderate carbohydrate, low fat, high protein, and high fiber diet. That's the term. That's the meaning of a diabetic diet, okay? So medical nutrition therapy, walking or physical activity, definitely. It improves your insulin sensitivity, okay? And stress management techniques. So this is the conventional treatment. And now let's look at what is the personalized approach. So combining all these, along with all these, we are also understanding the root cause of it. The root cause of diabetes is very important to be understood, because if you do not understand that if this is a genetic problem or occurring due to a person's lifestyle, you'll not be able to address the root issue, okay? So then it'll be very temporary, okay? Then secondly is to provide gene-based solutions. So we're not doing R&D on that patient. We exactly know where to work on. Right? We know कि इसके जीन में ये problem है, इसको ये काम करेगा, ये काम नहीं करेगा, for example. Right? So we are hitting the target directly. We're not going and, trying different things. Okay? And of course, there are personalized lifestyle modifications. So let's say if somebody has a habit of having late dinners, okay? And we know that, as per your genes, it's not good to have a late dinner for your blood sugar levels. So maybe that person can also consider adopting a better lifestyle and having an early dinner, right? Or he or she can make the entire family a part of it, so that nobody suffers, because late night dinners are anyways not good, not advisable. Correct? So this is a personalized approach, and this is what we've been doing till now. So if there is a blend of both, what happens is, when you have targeted the root cause of diabetes, these two things will definitely wean off, okay? So that means your body will stop being dependent on the drugs, as well as in some cases even insulin. I'm talking about type 2 diabetes, okay? Clear? Let's understand further. So now we come to the role of genetics in diabetes. Now, I want you all to focus here, because this is where exactly you'll come to know the gist of it, okay? So you'll come to know the essence of this meeting today. So what is the role of genetics in diabetes? So the genotype that you carry, that I carry, that she carries, that he carries, can be detrimental in two ways. It can hamper you in two ways. One is, genetic mutations can increase the risk of diabetes mellitus. So if I'm born with a genotype that gives me a higher risk of diabetes, then I will definitely have a chance of getting diabetes, okay? And secondly, even if you do not have a gene, okay, that will directly increase the risk of diabetes mellitus, but if you have a genotype that can facilitate or support the action of an external factor in producing the disease. So for example, let's say you do not have a risk of diabetes in your genetic report. After you've done the report, it says that you do not have a risk of type 2 diabetes. It's a typical risk, okay? So that means it may not directly lead to diabetes, but through some other condition, you can also get diabetes. Okay, so we also need to be careful. All right, so let's say if you have a gene that makes you prone to stress, okay, that can also be a trigger for your diabetes. Are you all able to understand this? Because this is very important for you to understand, okay? I want you all to write it in the, yes, absolutely, the epigenetic way. Very good. Superb. Lovely. So put it in the chat if you have understood till now. Okay, now comes a very quick, view of how this works. Okay, so let's do that. So assuming that let's take an example of a patient. Let's take an example of my report. Chalo. I mean, I'm just hypothetically saying, okay? So let's say that I do not have a genetic risk of diabetes. So it's a protective gene that I've got for diabetes. So there's no genetic tendency for diabetes. And secondly, my environment is also protective. So I have a protective gene plus a protective environment. What does a protective environment mean? I do not eat junk. I keep a tab on my processed food intake. I also consume whole foods. I do exercise. I do stress management. I sleep on time. I get up on time. I take the morning sunlight. I have enough water, etc., etc., etc. So that's your epigenetics that we are talking about. Okay. So you have a protective gene plus you have a protective environment, a good healthy lifestyle. So what would be the outcome? Low disease risk. What would be the outcome? Low disease risk. Now, if you have a genetic, you have a protective gene, but look at the left side of it, you have a risk factor in your environment. That means you live an unhealthy lifestyle, for example, okay, in any way. Whether it is junk food, whatever I just said is the opposite. Whether it is a sedentary lifestyle, whether it is, smoking alcohol, etc. So genes are protective, but environment is unhealthy. What can that lead to? That can lead to a moderate or a medium risk of diabetes, because one factor is affected here, definitely. And don't you think this is very easy to control? Yes, it is. That's exactly what lifestyle modification is, right? So you have a protective gene, but you have a poor lifestyle. This can be improved, and this genetic risk can be suppressed, yeah, not expressed. Correct? Now let's look at another scenario. Okay, let's say that you have a poor gene. I mean, genetic is not, you do not have a protective gene. You have a high risk of diabetes. In your genetic report, it shows that you have a gene that has a mutation that can give you diabetes mellitus type 2. Okay, but if your environmental is protective, you have a good environment, good lifestyle, it can again create a medium disease risk, because as I said, one factor is affected here. Okay, but if you have a poor gene, I mean, if you have a genetic mutation, and to top of that, you have a bad lifestyle, oh my God, then you have a high disease risk of that problem. You have a very high disease of diabetes mellitus. So just take a screenshot of this. So this is the entire puzzle that is solved now. Okay, so if it's genetically protective and environmental protective, you have a low disease risk. If you have a risk in your gene, but you have a good environmental factor, you have a medium disease risk. Okay, but you have a genetic risk high, and you're living a poor lifestyle, it can lead to a high disease risk. You are at a very high chance of getting diabetes. Clear? This is applicable to almost everything. Okay, clear? Okay, can I go ahead now? Yeah, I hope you've taken. Yes. So there are many more factors. I just mentioned a few when it comes to environmental risk factors. So yes, we do have, Dr. Arora has correctly put it in the chat, that, we also have chemical intoxication as a trigger. Absolutely. But yeah, we are not here to actually, so that's exactly what we do in counseling. So when we counsel a patient, we cover all these, lifestyle factors, right? All right, chalo, let's go ahead. And how can you prevent or manage your blood sugar levels using the Velocity Lifetime Genetics Program? So the Velocity Genetics DNA testing program covers over 300 tests. So this also contains your diabetic profile that I'm going to talk about today. Yeah, so it's a once in a lifetime program. Okay, it's a once in a lifetime genetic test, because genetic tests you don't need to do it over and over again, right? Because anyways, the genes are not going to change, right? So once in a lifetime test. Correct? So this is how the new report dashboard looks. So it looks like this. Okay, so the person is given, so when he enrolls for the genetics, the DNA testing program, He's given a dashboard, he's given a ID password to log into that dashboard, and uske andar unka report dikhta hai, right? So this is how the report looks like. Okay, so his lifestyle profile, everything is seen here, your his lifestyle issues, your health goals, everything, and then there is a DNA report segment here that he can access from. Okay, let's go into the diabetic panel of this report and understand what tests are done to assess your risk of diabetes, and you can take timely measures to control that condition. Okay, let's talk about the first thing. The main parameters here, and that is the diabetic and lifestyle panel. Here I'm going to talk about this particular panel wherein all the phenotypes here are related to diabetes or its complications. Okay, so type 2 diabetes risk. Okay, diabetic retinopathy, which is a complication of diabetes in which the eyes get affected. Okay, cardiovascular diseases, diabetic nephropathy, diabetic neuropathy, foot ulcers, diabetic cataract, and insulin resistance. Apart from that, we check you for your insulin response to exercise as well. Okay, so if you exercise, well, if you are blessed with a good gene, if you're gifted with that gene, you can leverage exercise for your benefit. Okay, and if you're not, then that's still okay. So what form of exercise to be done in order to make sure that you have effective utilization of insulin? Secondly, insulin sensitivity and regulation of energy intake. So whether your genes, the genes that you are born with, are pushing you towards insulin sensitivity or insulin resistance. They are two opposites. Okay, so insulin sensitivity means effective utilization of insulin, and resistance means no, they're not identifying insulin. So all the processes are getting hampered. Okay, we'll look into that in detail. And lastly, what is the connection between vitamin D and type 2 diabetes in your body? How does it look like? So that is why it's a personalized approach. And apart from that, we also have other phenotypes that are linked to diabetes. One is gestational diabetes mellitus. So in females, we check if, in pregnancy, they have a high risk or no. And how do you prevent that risk? Type 1 diabetes risk. So whether a person is at a high risk of this autoimmune condition. And the third one is blood glucose response to exercise. And of course, we also check you for pancreatitis. Pancreatitis is an inflammation of the pancreas that can drastically reduce your insulin secretion. Clear? Take a screenshot. I'll go ahead. Okay. Now, knowing your genetic risk of getting diabetes. So type 1 diabetes, as I said, it's an autoimmune disease. So I'm just giving you a gist of all the points that were mentioned on the last slide, what it is exactly. I'm just explaining that in short. So yes, it's an autoimmune disorder wherein the immune system attacks the normal body cells, especially pancreas, and where the beta cells of pancreas where insulin is made. Right? So genetics play a very important role in the onset of this disease. Type 2 diabetes, and see, about 90 to 95% of people living with diabetes are type 2. Okay, so yes, so this, if you know the genetic predisposition, you can prevent this lifestyle issue. The third one is gestational diabetes. Gestational diabetes is high blood sugar during pregnancy, as I said. What happens is the placenta in the that connects the mother to the child. So in that, the hormones increase, okay, which cause the body to become slightly resistant to insulin, so that the fetus gets enough of sugar. Okay, so if this happens and it causes abnormally high blood sugar levels, so then it can lead to pregnancy, gestational diabetes mellitus, and there are certain genes that are responsible for this. We test you for those as well. Okay, not just these three forms of diabetes. So we're not just testing you for diabetes, but we're also testing you for the complications of diabetes. And what are those? So as I said, one of them is cardiovascular disease. So cardiovascular disease also occur because of diabetes. Diabetes jab aata hai to akele nahi aata hai. It gets some or the other health condition together. Okay, it can invite certain diseases, and one of the topmost is cardiovascular condition. So yes, it can cause problems with the heart and the blood vessels, and certain genetic variations influence the risk of developing this disease. Diabetic nephropathy. What happens in nephropathy is that the kidney basically filters the blood, correct? So that process is hampered because of the damage caused to the kidneys. So all these, one such symptom is proteinuria. Proteinuria is when protein leaks into, comes into the urine, right? So that is one sign of nephropathy. All right. And if you have the genes for diabetic nephropathy, you need to know how to prevent that, how to manage that. Okay. Then there is neuropathy. What is neuropathy? You cannot feel a diabetic person who's, who has uncontrolled diabetes. In that case, what happens is the nerves are damaged. Okay. So neuropathy is basically the damage to the nerves that occurs because of high blood sugar levels. All right. So there is a poor sensation of, whatever, like even if the person, sometimes they don't even, doctors say that, sometimes they don't even know unka chappal kab gir gaya chalte chalte. So their slipper is off and they don't even know, right? So they don't feel any sensation. That's the very high case of that. But yes, it does happen. Okay, so there is total loss of sensation in neuropathy. We also check you for the risk of diabetic retinopathy, as you saw in that list. So retinopathy is caused by the damage to the blood vessels in the retina due to high blood sugar levels. So retina, which is there in the behind the eye. So if this is your lens, it directly is right behind your eye. And then see what happens in diabetic retinopathy. There is the damage to these blood vessels. Okay. So yes, it can also lead to blindness. Okay. So if you know your risk, you can prevent it in advance. Diabetic cataract. It causes a dense, cloudy area. Cataract is what? Clouding of the eye lens, right? If you are at a risk of diabetic cataract, it can create, if you don't take care, if you don't know what to do after, to minimize the risk of this or to prevent the risk of this, it can definitely lead to advanced stage of eye disorders, especially even visual impairment. Okay. Foot ulcers. So we discussed in symptoms that, sores are very difficult to heal. Yeah, difficulty healing the sores. So this is one of them, foot ulcers. Because there is ineffective repairing of the damaged skin in diabetes. So if you have a high risk of foot ulcers, we exactly tell you what to do to take care of your foot. That comes in your epigenetics. So now you understand genetics versus epigenetics. Okay. Insulin resistance. So it's also called as low insulin sensitivity. So as I said, insulin resistance and sensitivity are two opposite things. Insulin resistance means the cells in your muscles, fat and liver don't respond well to insulin. So यहाँ पे आप देखिए sugar आ रहा है खाने से और ये pancreas से insulin आ रहा है. Your blood sugar should come out, right, and go into either of the three. All the three. It should go into the fat cells. It should go into the muscle. It should go into the liver, right? But if there is resistance, it will not go into these because they are not recognizing it, and it remains in the blood and creating a high blood sugar kind of a scenario. Okay. The same, the opposite of this is insulin sensitivity. So insulin sensitivity, agar aapka pata chalta hai aapko, if you come to know through your genetic report, we know exactly how to leverage it through epigenetic mechanisms. Okay, so efficiency of insulin in removing glucose from the bloodstream is called as insulin sensitivity. Means your insulin is sensitive. It is sensitive. It is listening to the body's needs. Okay, so here what exactly is happening is all the insulin and the blood, the insulin is taking the blood sugar to the cells very effectively as compared to this. So there is normal blood sugar. Okay. And the last four things, insulin response to exercise. So exercise also has a higher chance to, it has the ability to balance your insulin levels. It prevents insulin resistance, okay, and it also lowers your blood sugar levels. How is your response? That you will come to know through the genetic test, because some genes also affect that. Vitamin D and type 2 diabetes. Vitamin D, the role of vitamin D is very, very important, because it helps you to activate the genes that are responsible for the release of insulin. Okay, if you genetically have a vitamin D deficiency risk, it can hamper your blood sugar levels, the balance of blood sugar. Okay, so that is equally important. So vitamin D and type 2 diabetes ka connection bhi hum check karte hain. And how is your how is your blood glucose response to exercise? Along with the correct diet, we all know that exercise helps you to balance your blood sugar levels, right? So which form of exercise, how often will help you to balance your blood sugar, comes down to genetics. And the last one is pancreatitis. There is an inflammation in the pancreas, which can lead to destruction of the pancreatic cells, and the beta cells, alpha cells can also get hampered because of this. If that gets hampered, then there is a problem regulating blood glucose, okay, and can also lead to diabetes mellitus. So if you have a risk of pancreatitis, what things do you do in order to prevent that risk? If you already have, then what do you do to manage that disease? Okay, so that's the difference between prevention and management. Okay, and so that's how this revolutionary scientific technology of this DNA testing program can put you miles ahead of others, wherein you'll be able to understand in advance कि आपको कौन सी बीमारी आ सकती है, especially diabetes में क्या complications आ सकते हैं, and how do you follow a correct lifestyle in order to prevent this. Okay, so that's exactly, so the Velocity Genetics DNA testing program works like this. So you buy the kit, okay, you buy the kit, the DNA testing kit. I mean, it gets delivered to you, right? And then you watch the video of sample collection. Why do we urge you to watch the video? So that there is no error in giving the sample. You send the saliva sample to our office in Mumbai. We send it to the lab, and the lab tests it, and then you get your genetic report done. And then you get a summary of your DNA report. You submit your health profile online on the dashboard that has been assigned to you. And then you get your genetic counseling done, in which we tell you what foods are good for you, what foods are not responsive in your body, what foods can hamper you, what foods can actually deteriorate your conditions, and what are the exercise strategies that you need to adopt, what are the sleep routine that you need to adopt, what are the other epigenetic factors, like how much water, how much what is your micronutrient macronutrient ratio, ideally what kind of a diet you should be following, all those things. Okay, and then there is an action plan that is given to you, which is a gene-based action plan. And then there is a help desk facility that you receive over the next 12-month period. So that helps you to understand, that helps you to ask your queries, and also for the counselor to understand whether you are following everything properly or not. Okay, yeah, so that's about genetic or genomic wellness, and these are our valued customers. So these are some known faces that you may have seen. Of course, we know Pratibha Tai Patil. We've had the honor of meeting her, and there are some Bollywood actors, there are some politicians, there are some, we also had a late Mr. Bejan Daruwala, and some cricketers out here, Mr. Nayan Mongia. So esteemed patrons who have taken this test and leveraged it to their best, So now it's time for you to take action. And if you want to take action, this is the right time. So do not delay it further, because the sooner you know about your risks, the sooner you can act on them. Yeah, do you all agree with me? The sooner you know about your risks, the sooner you can act on it, right? So with that, I would like to say thank you, and yes, over to you, Florine ma'am.
Yes, thank you. Thank you so much, Riddhi ma'am. Such a wonderful knowledge you have given. Friends, knowledge is power. Cancer always says knowledge is power, potential power, but if it is not used, it is garbage. So prevention is better than cure, and prevention is always cheaper than cure. And when we come to know the root cause of her problems, like I said about my daughter, the root cause for her type 1 diabetes was she was lactose intolerant and gluten intolerant. Whole life, what we do, eat chapatis and we eat milk, ice creams. For example, if you have a petrol car and we put diesel in it or kerosene in it, how long it will run? Somewhere it will damage the engine. Same way, now we have so many things we have learned. I have could not write all the notes, taken all the screenshots, ma'am, because it is really, really very helpful, because so many things and we won't remember, one seminar, what you say. So please, friends, if you have any questions, Riddhi ma'am is here to answer.
Yes. You can put it in the chat or you can raise your hand. We can unmute you. Yes, Yes, Dr. Arora. One sec, I'll unmute you. Welcome, sir.
Thank you. Wonderful, wonderful communication to everyone. And
thank you so much, sir.
One thing I would like to add into this is my recent, around 30, 40 different patients. They were all high party goers, late night parties with a heavy drink, non-diabetics.
Correct.
Can you imagine? HbA1c normal, average blood sugar normal, daytime blood sugar is normal, but fasting sugar is 140, 150. This is a new identity of diabetes can set in like this.
Absolutely. Absolutely.
So I told them, you all have a susceptibility. It may not be visible in the laboratory examination, but one test have indicated to go for your genetic assessment. You will come to know whether you are going to suffer. But the worst thing which will take place, your high sugar level, which is going in the whole night, it will cause slow level of vasculitis.
Absolutely
which
correct.
will result into sudden death.
Yes. Yes. So it's like, you're sitting on a ticking bomb.
Yes.
Right. So yeah, so that's what, and that's what the conventional line of treatment says, that you just go look into one direction, but now the new science says that you need to explore other areas as well. You also need to see the other effects of diabetes, right? And you contributed a very important point about chemical intoxication in the chat box. That is another problem, waiting to explode. Yeah, so yes, that's very,
on
very
7th
important.
of December, I'll be talking on that subject. It's a massive.
I'll wait for it.
It's a massive, but I will try and cover it. The dimensions are phenomenal. We in our country, not only in our country, the world over is not aware of it.
Yes.
And they are not even bothered. Another worst thing which is taking place, a lot of GMO food is coming to India.
True, true, true.
A lot of genetic changes will take place because huge amount of kheti is being done with those GMO produced seeds. What it is going to cause, it's going to be phenomenal, just phenomenal.
Absolutely. And I'm very excited to attend this session by you, sir. So I'm waiting for this. Thank you so much for your contribution, so nice, sir. Thank you. Thank you. Okay, anybody else? Okay. Mr. Iyer, 1 second. I'll unmute you. Yes, sir.
Hello, I can hear you.
Yes, yes.
Yeah, see, why you can't, panel only for diabetic?
Sorry?
Only for diabetic if you have a, panel.
Okay, okay. I'll take your suggestion. I'll take your suggestion. So today's answer is not here, but I will definitely put it forward to him. Okay. That's a very nice suggestion. Yes.
Yeah, in fact,
okay. In fact, we were considering that, and that is still, that's work in progress. So that's happening on the back end. So yeah, but we'll definitely bring it.
because I am diabetic, faced with lot of complication.
Yeah.
And, first actually you have to hit diabetic, the people are ready, automatically go with other panels also.
Correct.
So we have to
Correct.
project diabetic panel first, because as you
Sure.
said,
Sure.
it's having a 44%, chance to increase.
Increase. Yes.
Yeah,
Yes.
even, yeah. So we have to tackle that first.
Absolutely.
Yeah.
I'll
Thank you.
take that, sir. I'll take that suggestion and I'll put it forward to him.
Okay.
Yeah?
Thank
Thank
you.
you so
Yeah.
much. Yeah.
Thank you. Yeah.
Okay. Anybody else? I can't see all of you, but yeah. Or if you want to put it in the chat box, you don't want to come up, that's also fine. You have any questions, anything to share, you can share your learnings as well. That's completely okay. I mean, we welcome that, right? So if there's anybody who has experienced something major when it comes to, changing their lifestyles with the power of genetics, you can come up and share your experience as well. No, that's it.
If somebody is not sharing, I will share. I have shared it many
please go
times
ahead, ma'am.
before. Because
Yes.
I started with my adopted child, Angel, when she was 9 years old. I adopted her when she was 2.5 years old. And from that time to 9 years old, she was always sick because we don't know her background, family. We just met and she asked me to become a mother and I became like that. I have 4 older children. It was not necessary. See, adoption is another different topic. If we all adopt families, every family adopts one poor child, orphan child, world will be more beautiful in life. But this
Absolutely.
child had always problems, cold, cough, loose motions, and constipation, these 4 things. Then one day when I was discussing with somebody, he said, Ki, we have some solutions here. We can find out the root cause. Mr. Albino, Mr. Albino?
Yes.
He told me during one Christmas event, we have a company that is also formed by Indian. We are a pioneers. They will find out the root cause why this child is suffering. See, my children, I know what they need or no. And I never been to doctors for my children when they were small. But this child, when I came to a velocity office, I had given up the job because of this child. I was not earning any money. And the price was, when they said, it was quite high for me for a test. But I thought, even this much amount, it's not a big amount, maybe a monthly expense for me. Okay, 1 month expense. But I thought, if I find out one root cause, what is causing a problem, this 9-year-old child has got a whole life ahead. Then we did the test. Mr. Melvin Crasto, he gave us a full presentation, as you gave, personal presentation. I was really touched. I just wanted to help this child. And she was found out lactose intolerant and caffeine intolerant. And what used to do, she used to vomit after eating food or in the evenings or maybe afternoon, morning, anytime. I would say, okay, now stomach is empty, give her bath, then give 1 glass of milk. Chalo, doodh pee ke so jao. Doodh pee ke aaram karo. What milk I was giving her becoming poison in her stomach. But moment I got this report, I stopped the milk on that day itself. A counselor, Reena Baliga, she told me she can have paneer, she can have curds, yogurts, and chas, buttermilk, etc. But don't give her milk or ice creams like that things. We stopped. But from that day itself till now she is 15 and a half year old. There is no such problem. I really thank God. And every seminar, whenever I get a chance, I tell everybody, thank God for velocity. We found it and we are the pioneers. And we today, whoever are there, 26 are there now, 24, more than 35 were there. We must tell everyone, promote this, our webinars and our seminars, our genetic reports, genetic tests, because with one test you come to know, now there are more than 300 parameters. If you come to know and you can work on it. Like I was supposed to be high diabetic, high problems, cholesterol, heart problems, But now I know, so I'm also lactose intolerant. I don't take lactose at all, no milk. And I know I must do my exercise. For me, it was a morning exercise. I've started yoga. So many things, prevention. So if you all learn to prevent,
yes,
after doing this test, we can have healthy lives. And as a 44% raise has come in the diabetics, but here afterwards it may be more, because as you said, we are the highest number in India, and these now in their genes. Now the blood sugar is in their genes. So the new generation will say it is a genetic. Now it is actually a lifestyle. Like doctor said, now it's a lifestyle, because whole night partying and alcohol, sweets.
correct.
It's a party lifestyle. But next generation will say it is a genetic. My father had, my mother had. So we have to teach people on prevention, how to prevent, find out the root cause and go for prevention. It is very, very easy, ma'am. Very easy.
Yes.
And we will wait for Dr. Arora also when he comes, and we will advertise more amongst our word of mouth. This every Thursday we have this special webinar.
Absolutely.
Thank you so much, ma'am.
Thank you so much for sharing
so
that and empowering more and more lives, because I know that, you have this lovely testimony to say, and with that, you are changing lives, and that's amazing. Thank you so much. I have just one question here. So somebody's asked me. Yeah, sorry, ma'am.
Arora sir is showing hand. Maybe.
Oh, okay. Sorry. Yeah, sure.
I wish to share it with everyone.
Yes, sir.
In India, the breast cancer among young ladies is growing up. The reason is very, 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 very interesting reason. India imports huge amount of tofu from US.
Oh, yes.
Tofu has got what? It's basically contains very high quantum of phytoestrogens.
True.
Phytoestrogens are good for postmenopausal old ladies. It gives them a young and energetic life.
True.
But if a young girls, let's say 8, 9, 10, 12, 13, 14, below 30, they start taking, there is a highest possibility of she may develop breast cancer.
Correct.
It's a hormone-stimulated breast cancer. I won't name the state, but I know it's fed in a big way as a milk.
Oh,
yes.
It is grown in India, but it is maximum nowadays is coming from US as a tofu. A lot of people eat, girls eat in the hotels, in restaurants, in friendship together. But if you start eating regularly, you are inviting a very high risk of breast cancer, which genes may not be having those changes.
Yes,
initially.
absolutely.
It's basically epigenetic issue. And when I was discussing in one of the meeting, a lot of people didn't feel like, they didn't like it because from that state. I said, you may like it, you may not like it. The truth, you cannot overrule it. There are 12 food items which has got a high quantum of phytoestrogen. You can check up on, you will find all those things. You should minimize rarity or do not give to young girls.
Right.
Even boys, those who take, they develop gynecomastia.
Gynecomastia, absolutely.
In US now, they are being found to have even breast cancer.
Oh, okay. Yeah, meals.
So one has to be very careful. Do not eat or drink blindly.
True. So as they say, one man's medicine is another man's poison. So that's very, very true in this case. Yes. So just, going behind the trend of plant-based diets and soy-based. So when we talk about plant-based eating, it's usually soy that comes to our head. And that's why we just end up splurging and, binging on soy products. So that's why this problem that occurs. Thank you so much for that sharing, doctor. And you're like a complete library. So I really feel very honored when you come on the screen and you enlighten us with your knowledge. Thank you so much, sir. All right, I have a question. Thank you, sir. I have a question here. I'll take that last question and then we'll end. So, okay, so Maino ma'am is asking me some basic foods and fruits that we should eat. Okay, so when it comes to diabetes, so especially you have a challenge with fruits, because there are certain fruits that can immediately increase they are very high on a glycemic index, and they can increase your glycemic load and thus increase your spikes in blood sugar. So it's always better. So first and foremost, we always say that always focus on the whole fruit and not a juice or a smoothie when you give it to a diabetic. Smoothie phir bhi chalega, especially if you have all kinds of healthy stuff added to it, like oats and chia seeds or nuts and seeds added to it. But juices is something that you need to stay away from, correct? Because what happens is, now people say that ma'am hum to juice banate hain par hum to usko chhante nahi hai, to fiber mil hi raha hai. But it's not the case. Okay, when you blend a fruit into a juice, you're breaking down fiber strands. Remember that. Even if you consume that fiber, it's of no use. Trust me, it's of no use, because you are destroying the structure of fiber. It is supposed to be chewed by teeth and not blenderized like that. Okay, so you're actually destroying the basic structure of fiber. So it's of no use. Instead of adding bulk to stools and reducing your blood cholesterol and blood sugar levels, it will not do anything of that sort. Okay, so it will just be like an added glycemic load. Correct? So first of all, do not give juices. Second is, to a diabetic, opt for fruits which have high antioxidant value. Okay, so in this case, I would like to say berries are very are a better option. Apples, because they contain quercetin. Okay, so apples also have soluble fiber, or pectin, as what it is called, right? So apples are good. Berries are good. You can also give them pectin is also found in guava. It is also found in pears. Yeah, so soluble fiber is very important when it comes to managing your blood sugar levels. Okay, and especially when it comes to fruits and basic foods. Agar aap aur kuch pooch rahe hain ma'am, to see, it should always be a high fiber diet. So there are 5 food groups that are high in fiber. One is your whole grains. Okay, so whether you are a gluten intolerant or no, if you're a gluten intolerant, leave aside wheat and barley and whatever the other grains are, millets, jawar, bajra, nachni, makai, etc. Second is your pulses, your pulse group. Your dals, beans, sprouts will all come here. Okay. The third one that is high in fiber is your fruits, the ones that I just said. The fourth one is vegetables. Yeah, so be it normal अपने जो regular vegetables है, जैसे भिंडी है, लौकी है, करेला है, so all your regular vegetables as well as leafy vegetables. So leafy vegetables also have a very high antioxidant value, and they also contain other vitamins and minerals as well, right? Apart from that, what Florine ma'am said in the beginning, and that is microgreens. Okay, so microgreens also come under the vegetables category. So you grow these small tiny little things, and they are a powerhouse of nutrients, much more than their mature counterparts. Okay, so if you have spinach microgreens, it contains 40 times more nutrients than the actual spinach plant. Okay, so that's one of them. Okay, so microgreens. So that's a vegetable category. And the last 5th category is nuts and seeds. So nuts and seeds will also help you to balance your sugar levels. Now, however, I've just given you an overview of 5 food groups here when it comes to fiber. But again, that will get personalized as per your genetic profile. Okay, so if you are, if you can have, how much walnuts to have, how much pumpkin seeds to have, that again depends on the current condition of that patient as well as the genetic tendency. So we do that in the counseling session, and that's what helps you in balancing your sugar levels. Right? Thank you so much for asking that question, and I hope that gave you some insight, and that will help you to take your practice even better. Okay. All right. So I don't see any other question, nor do I see any other hand raised. So I assume that's it. Yeah. Thank you for joining, everyone.